Our MyChart bedside tablets came out just in time before COVID when Epic rolled out. While patients were unable to have their loved ones visit during COVID, it was so comforting for patients and staff that we were able to connect them through video chats on our new iPad tablets. It was emotional to see the way patients and families' spirits changed when they were unable to see each other's faces. Some moments were cheerful and some were sad, but there was comfort for everyone in knowing that we could connect them when there were no other options.
In a time where not many people were allowed here, it gave a lot of families closure on family members that they weren't able to see. I actually introduced one of the patients to one of their new grandchildren right over the tablet because they weren't going to be able to see them. So it was a really beneficial experience for everyone.
Right before we had the video chat options on our tablets, patients wanted to FaceTime with their families, so a lot of us nurses use our own personal iPhones and FaceTime IDs to connect them. We would have to put little plastic bags over our phones to protect them, but once we had the video chat options on the tablets, it was so convenient for us and nice for the patients to have their own tablet to use whenever they wanted to connect with their families.
Wasn't able, obviously, to come visit her father. We got the iPad out for her. He could still hear her, and he was responding to her over the iPad. It was just really was a beautiful thing. She got to say goodbye to him, and he got to hear her. Without the iPad, during that time, they would have had no resolution, no communication. It was really something to see, and I was so grateful that we had that for her.
Families really appreciated the opportunity to be able to at least see their loved one on the iPads, even if the patient couldn't speak to them, just to be able to see them and be there for them and talk to them really helped provide them with a lot of comfort.
I had a specific patient who was actively transitioning. There's 2 daughters to this patient. They were so grateful to at least be able to see mom and say what they needed to say to her. And that was really challenging as a nurse. You want to make sure that the daughters got their time and that you also too were able to help, get them connected, and it was a very beautiful experience.
However, we had numerous families reach out to me, myself as a manager, saying thank you for that, thank you for your nurses and staff going above and beyond.